What's going on? What's going on? Happy Easter, everyone. Welcome to the Urban Health Nurse Educator. I am your host, Steve Belcher. So today we're going to be talking about in episode 4, health literacy. What it means to you. That's right, health literacy. Did you know 36% of adults in the US struggle to understand basic information about their health? That's right, 36%. And it could even be more. So, whether it's choosing a doctor, knowing what medications to take, or planning a meal, people make health decisions every day. If you're watching this broadcast, I'm sure you have to make some type of health decision every day. These choices can have significant, and I mean significant and long-term impact on the person's health. I'm serious. How many people you know, or even yourself, have a hard time struggling to read insurance papers, understand what doctors are saying, medication dosage? So look, this is why health literacy, which is the skills and capabilities needed to understand basic health information and the impact these choices have on one's own health and available treatment, is critical. It's critical because if you don't know what type of choices you have, and you go in thinking you know one thing and you don't, or you don't understand, and if you don't ask questions, this can have a significant impact on your life and health. That's why it's critical to build a strong foundation for good health. Now, let me tell you about health literacy. People with limited or low health literacy skills, such as reading, calculating, communicating verbally, and critically analyzing information, are less likely to understand medical tests, labels, and instructions. I'm telling you. Now let's talk about health literacy. Health, you may say, Steve, what's health literacy? You keep talking about health literacy. I kind of went down a little rundown, but I want to tell you about health literacy. Then I'm going to give you some helpful tips to make your doctor visit more helpful. So health literacy is the ability to understand your health, medical care, and overall wellness. Research shows that many adults find health information hard to understand. They do. And a lot of people don't want to tell you that they don't understand it because they may feel embarrassed. So look, don't be. 36% of people don't understand. This includes what doctors, nurses, pharmacists, and other healthcare professionals say, written medical instructions, and health insurance forms. I'm telling you, I cannot overemphasize this. Even as a dialysis nurse, when I uh, admitted patients and did the informed consent, a lot of times I had to read the document or the consent form to the patient because it was too much. A lot of times this affects the elderly. The family didn't want to read it because they didn't understand the medical jargon. So I had to break it down to them. Even when people have good access to health services, lack of information can make it difficult for patients and families to properly manage their health. Most people may find health care terms and instructions challenging to understand. However, low health literacy is particularly common among, check this out, elderly persons, individuals with a chronic illness or disability, persons who live in poverty, individuals who do not speak English, and persons with a mental illness. Please subscribe to the Urban Health Nurse Educator YouTube channel. This show actually is being recorded to be uploaded as episode 4. So please subscribe to the Urban Health Nurse Educator YouTube channel for more dynamic topics. Now, research studies are looking at ways to improve easy to understand health information to help people with low health literacy make good decisions. In the meantime, the Urban Health Nurse Educator is going to give you some helpful tips to make your doctor's visits more helpful. Let's get started. Number 1, for any medical visits, take a trusted person with you, such as a family member or close friend. Number 2, always, and I mean always, ask questions. If you do not understand something, that's very important. Do not walk out of that office if you do not understand anything. Your doctor, and I hope they do, wants to make sure you know your condition and how to follow any medical instructions. Number 3, always, and again, always bring to any medical visit an up-to-date list of all medications you take, including over-the-counter and any natural or herbal preparations you may want to bring all these medications to your next visit. Number 4, write down your questions and concerns before you go to any healthcare visits, so you don't forget what questions to ask. How many people have went to the doctors, you had a question you wanted to ask, and when you got there, it slipped your mind? Where did it go? Where did it go? Number 5, ask your doctor to write down information and instructions discussed during your visit. Very important. Again, ask your doctor to write down information and instructions discussed during your visit. How many people went to the doctors and when you left, you forgot what they said? How many? I'm sure many people have forgot instructions given to them by their doctor after the appointment, whether it's when to come back, how much you want me to take, did he change the dosage? It could be anything. Number 6, if you have a vision or hearing problem, ask for help. Do not be ashamed. Your doctor can provide information in large print or use other resources to make sure you get good information. Now, I'm going to give you some reliable information that you can go to and get information on health literacy. The internet is good for can be a good place for sources to get health literacy information. However, you have to get trusted information from trusted websites that keep their information up to date. Here are some tips to help you start your internet search. Go to government sites. Even I know some of us don't trust the government, but they do have some good information. The National Institute of Health, www.nih.gov, and Center for Disease Control and Prevention, www.cdc.gov, provides accurate information to patients and families, and can also point you in the right direction for other sites. Then you got nonprofit organizations like cancer.org, American Heart Association, and all kind of other nonprofits. So thank you guys for watching. That ends episode 4, Health Literacy, What It Means to You. We hope you enjoyed it. Again, subscribe to the Urban Health Nurse Educator YouTube channel for more variety of programs. Thank you guys. Enjoy your day. And again, happy Easter. Peace and God bless.